Kawasaki Disease Integrated Information Sharing System, Kawaiiss. In managing patients with Kawasaki disease in acute and chronic stages, we should consider multiple clinical parameters, for example symptoms, laboratory values, echocardiological data, and treatment taken. However, information in the electronic medical record system is scattered across multiple windows. We developed Kawasaki Disease Integrated Information Sharing System, Kawaiiss. Case metadata, echocardiography data, and laboratory data are synthetically stored in the relational database. Kawaiiss is accessible through the hospital intranet with internet browsers. This shows integrated information for a case of Kawasaki disease. She was 1 year and 5 months at the onset. The treatment was commenced at 4th day of illness. Additionally, IVIG and cyclosporin A were administered on day 7. She was discharged on day 13. These 4 columns on the left of the screen show the size and Z-scores for the 4 branches of coronary arteries. In this example, the left main trunk gradually dilated from dilation on day 6, which is colored with yellow, to a small aneurysm on day 10, colored with pink. Subsequently, this aneurysm regressed to a normal size. These columns to the right of the screen show the laboratory data. In particular, please pay attention to this IgG column. Yamadaki Nakashimada et al. Reported that low IgG values recorded before and after the first IVIG predict the non-response to this treatment. They also show that the cutoff IgG level below which the treatment more likely fails is age-dependent, as shown in this panel. Kawaiiss colors IgG blue if the value is lower than this cutoff. This may be helpful in differentiating a relapse of Kawasaki disease and a rebound fever, which is possibly a drug reaction to IVIG. In this way, this system helps the decision-making of whether to administer additional IVIG or not. The bottom of the screen indicates the risk scores of Harada, Kobayashi, Egami, Sano, as well as Ravelli's score for macrophage activation syndrome. All these scores are updated daily using the worst value in the course of illness. As a matter of fact, any original score can be implemented. A large number of laboratory variables can be exported from the electronic medical record system into Kawaiiss instantaneously by automatic string recognition. You do not have to type the laboratory values. This system can be used for research purpose. For example, Kawaiiss can assist in a future prospective study which is aimed at identifying etiological agents for Kawasaki disease. In such a study, we have to match Kawasaki disease patients to control subjects on the timeline. If we move simply from the earlier patient to a newer patient, some patients always fail to match. For example, patients 6 and 8 in this example. Repeated shuffling of both patients and controls can avoid any bias from the deterministic matching and maximize the matched Kawasaki disease patients. By using this double shuffle algorithm, sex, age, and date were matched between Kawasaki disease patients and control groups. Even for the small number of individuals, Matching would be very difficult without this algorithm. Kawa-IISS enables pediatricians and cardiologists to share clinical, echocardiological, and laboratory information. This system aids decision-making by flagging data outside thresholds. Kawa-IISS can also generate a file to be submitted to Japan's nationwide surveillance. In addition, this software can facilitate epidemiological study, for example, matching Kawasaki disease patients to control subjects. Thank you very much, everyone, for listening.